All right, I want to welcome you, President Klein, to Equitas Health to learn about one of our very important programs. We have our SafePoint program and pharmacy services that are really critical in addressing the heroin epidemic in our community. In January of 2016, we started our comprehensive harm reduction program. And basically what that means is we are supplying things like safe usage of needles, education around that, clean syringes to address both the HIV and the hepatitis C epidemic in our community. We're talking about mental health services, alcohol and drug referrals and assessment services for people who may be ready to get into recovery. We're also offering things like HIV and HCV testing, treatment, mental health in regards to whether it be HIV or their substance abuse, but also linkage to medical care. And then a big piece of that program is access to the Naloxone, which is the overdose drug that helps save lives. And in the last 2 months, we have a patient assistance program that assists those folks who don't have insurance or who are underinsured with access to Naloxone. And in the last 2 months, we've been able to prove that 16 lives have been saved because of that program. So it's very exciting for us. Our mission has always been focused on improving people's lives and saving their lives as a whole. We've had patients who've said, it's nice to come here because you treat me well. There was a woman who actually smiled at me in the hallway. So we have a lot of folks who are using drugs, who have been treated poorly, who are fighting that stigma every day. And unless they can build that trust through a program like ours, it's hard to take that next step to get into recovery and into treatment. We also had one individual who brought in 2 friends who were hepatitis C positive because he knew that if they were sharing needles, that they were also sharing hepatitis C. And then one gentleman came in and said he had saved his girlfriend the week before with Naloxone. So very excited about that program overall. We launched our patient assistance program. The application takes 2 minutes to fill out, so we tried to make it very simple. What we do is we also though check to make sure folks don't have insurance. That way it doesn't cost the program if they have the ability to pay. And then total, it takes about 20 to 30 minutes to both process the prescription, get the education, because part of Naloxone is making sure you know how to use it. There's no need having the prescription if in the moment when someone is overdosing, you can't use it. What's very exciting too is in Ohio, you can actually come to pharmacies that allow this and that are approved for this and get Naloxone without a prescription. So at our pharmacy here at Equitas Health, you can come in without a prescription. Most insurances and Medicaid cover it, and you can get that life-saving drug for individuals moving forward. And again, saving lives as we go. So we'd like to take this opportunity to walk you through the process, show you how easy it is to get Naloxone, and so we'll walk you over to the pharmacy.
All right.
Well, I'd like to introduce you to one of our pharmacists, Phil Povlinch, and he's going to walk you through the process.
All right. So I'm here. How does it work?
So awesome, you're interested. So full name, date of birth, address, allergies, all those information. If you have an insurance card and you're interested in getting it on your insurance, I
can just like give the insurance. Okay.
Exactly. Enter it into the system. It's very similar to if you were to stop into a pharmacy and kind of get a flu shot. Fill out some paperwork, and then I'll run it through your insurance plan, and then it'll send us yes, it's covered, no, it's not. Do you have a copay? What the copay is and stuff like that.
What do you see generally with the reaction from insurance companies? Is this something that typically is covered or is not covered, or is there a trend moving because of the proliferation?
So there is a large trend. So when we first started our program of Narcan access back in September of last year, a lot of insurance companies were giving us some pushback, either not covering it all or charging patients high copays. But now with all of the media and stuff like that going on, I've seen a lot of more insurance companies willing to pay for it and willing to pay more for it. So that patients are either paying no copay at all or very low copays like $10 or $15. The nice thing is that the Medicaids really followed suit.
Okay.
Yeah. So essentially, once I get that through the system and we fill it like any other prescription, so we have it labeled by a technician, checked out by a pharmacist, and then brought back up to you. We ring you through the register over here. So if you do have a copay, you can pay it at that point, and then after that, we take the Narcan in hand with our little counseling sheet here, and we go over to a space that we can privately meet one-on-one and go over everything you ever need to know about Naloxone.
Okay.
So should we
let's see the demonstration.
So I am going to go through everything with you as I would a
Yeah,
normal
please.
patient coming in to get naloxone. So the first thing I like to cover in these counseling sessions is making sure that we both understand the risks for an opioid overdose. First off, anyone using an opioid of any nature at all is technically at risk for an overdose. So people on pain management, things like OxyContin, fentanyl.
Not just heroin.
Not just heroin. So including heroin, though, is one of the things. There are a bunch of other factors that can kind of increase our risk for this overdose. So the most important factor I like to talk about first is mixing other drugs. So when we, say for instance, are using heroin, and then we are using other medications like benzos, so Xanax, Valium, Klonopin, things like that, or even alcohol, anything that kind of depresses your system is something that can increase your risk for experiencing an overdose at that point. Another thing that's really important is overall health. So say for instance, we have an impaired ability to get rid of drugs, we have liver or kidney problems, or even asthma or COPD, something that involves our breathing. Anything like that is going to increase the risk of you experiencing a fatal overdose.
Okay.
One point that's not often understood is the idea of tolerance. So say for instance, someone's using a drug on an everyday basis, they need more and more of the drug each time to get the desired effect. Problem is when people take a drug holiday or go a couple days without using, say they go into a rehabilitation facility or whatever and come out, if they go back to using the same dose they were on,
I see, yeah.
their body can no longer tolerate that dose.
Is that what typical overdoses are? Is it because they have taken that break for whatever reason and they think their tolerance is as high as it was?
Exactly. I've seen a lot of our patients come in and say, you know what, that's the time I experienced my first overdose, is when, as soon as I was out of rehab the first time I used, because I didn't use the appropriate amount. So that's something that I make sure every patient is aware of, that that's something that we really strongly have to consider so that they can use safely in the future. Other things I go over next is essentially how to recognize the signs of an overdose. So have you ever heard of any signs of an overdose in the past? Anything that kind of flagged in your memory?
Just, I mean, with the conversations I've had with the proliferation of heroin, just hearing people's stories of passing out and their eyes rolling in the back of their head. And
Exactly. So it's very, very common symptoms like that. So like nodding out is one. The big overarching symptom that we're looking for is non-responsiveness. So when you shout their name and they don't wake up, or you shout, hey, whoever, and they're not really responding to you, the next step would be to check to see if they would respond to like a sternum rub, which, let me move my ID here. It's when you take your knuckles, you place them right here on the sternum, and you rub it hard in a circle. The reason why we recommend the sternum rub, because it's something that can easily wake up anyone out of like any sleep at all. But if they are experiencing a true overdose, and if that doesn't work, that's a sign that they are in an overdose.
Okay.
Many common other signs and symptoms, like I'm sure you heard of blue lips or blue fingertips, sign that we're not getting oxygen to where we need it to go. Vomiting can be one, snoring can be one, or loud gurgling sounds. So one thing we always look for, are they breathing or are they not breathing? So we kind of, technically if they are having very slow breathing, they can still be in overdose, and it would warrant giving them a dose of Narcan or Naloxone.
So if you're finding yourself in a situation like that, and you feel that you need to administer a dose of Narcan, do you also recommend calling 911?
Yes, absolutely. So that's getting into our next point. Once we recognize we have a true overdose and it's not someone asleep or someone like choking on something, the next step is that we absolutely call 911. Reason being is what we have here, it is an antidote to an opioid overdose, but it is not the answer. Every time you experience an overdose, that is a medical emergency. This may not last, it may wear off. So this can only last in some people 20 to 30 minutes, or depending on what they used or what they injected, they might even require 2 doses to bring them back from overdose. But if they injected something that, for instance, stays in the body really long, like fentanyl, these medications will wear off and the person will slip right back into overdose. And then you don't have a dose around to give them, and the ambulance isn't there because you didn't call 911. We really, really, really urge each and every one of our patients that when they see an overdose, it's call 911.
Okay.
So that is one thing we always talk about. So moving on to administering naloxone. So we already talked about recognizing the signs and symptoms and making sure that they're unresponsive. One thing I do recommend, though, after we call 911 is if they're not breathing at all versus if they're breathing very erratically. If they're not breathing at all, it's recommended that they receive 1 rescue breath. which we're not ever recommending full CPR because obviously most of our patients aren't CPR certified, but basically it's kind of important if they're not breathing at all to give them that one rescue breath prior to administering naloxone, which is basically pretending that the back of my chair is the floor. You're going to get them right on their back on the floor. The big important point that everyone forgets is to tilt the head back.
To open up the airway.
Exactly. So if you just blow in like this, it's not going to do them any good. You want to make sure you tilt the head back, make a seal, plug their nose, make a seal with your mouth in there, and administer one breath. Once that's done, we can go ahead and talk about the naloxone. So there are many different forms of naloxone. There is a pre-filled nasal syringe, which is what I'm going to demonstrate today, which is the cheapest generic we have here. There's a brand name Narcan, which is nice as well because it's a one spray and one nostril kind of gig there. And there's also intramuscular naloxone, which is available for both a vial that you can draw out with a syringe and administer, as well as a auto device called FZO. So here we have the three main products of the generic naloxone. This is something that is sold separately, but you have to get it with each prescription of naloxone because this by itself isn't enough to have a successful save, essentially. So this is a nasal atomizer. Why this is important is because this makes the naloxone such a fine mist that even if the patient's not breathing at all and we're spraying into the nostril, it makes it such a fine mist that it gets absorbed straight through the nostrils. So that's something that's really important that I want to make sure every patient is aware that they need to be using these tools all together. So as you can see here, there's it comes with a yellow syringe device, whatever you want to call it, to make it into a nasal spray. We're going to pop off that yellow cap there. We're going to screw the nasal atomizer on here, just like pretty easy there. You can see it's just you screw the blue part on. And then you're going to pop off the yellow part, pop off the purple cap, go ahead and screw that in. If you notice, there is a needle going down the center of the device that kind of just pierces the rubber stopper there. And then once you get it past there, it's going to become a nasal spray like any other nasal spray you'd find over the counter.
And just squeeze?
So just like that, you can go ahead and
just squeeze?
Exactly. So it's important to squeeze it like you did, a short, quick squeeze. In each of these vials, there's 2 mLs. It's ideal to administer 1 ml in one nostril and the other ml in the other nostril in that short, swift pulse like that so we get a good mist. But I always counsel patients, in the heat of the moment, if you administer the whole dose in the one nostril, it's probably still going to work. Just keep in mind, if you have to administer a second dose, do it in the other nostril.
Okay. Did you all see that? Just how
it sprays out. So one important factor is, so we administer the naloxone and we're checking their response and they're still breathing slowly or erratically or their pulse is still low. They're not really responding. You want to administer another dose after 3 minutes. That's our magic number. I always tell them if they're not up and awake in 3 minutes, go ahead and give the second dose. By now you'll already have called 911 and the ambulance will be on the way with medical professionals able to handle the situation.
Okay. Well, thank you for the demonstration.
No problem.
I'm a firm believer, and this is a great opportunity to talk about this because of the number of people that you see coming into your doors because of the proliferation of the opioid epidemic in the city of Columbus and across Franklin County. And right now it's heroin. In the future it could be another drug, but I think we have 2 choices. We have a choice to ignore the problem and just say these people are addicts and let them deal with it, but that becomes a social issue. It becomes a taxpayer issue to the taxpayers of the city of Columbus, and it becomes a health issue. Or we can do the other choice, and that's what I think this and what Narcan and what Equitas is doing, and that's to recognize that people are sick, that they have problems, that we need to give them the opportunity to get a second chance because that makes us safer as a community and makes families stay together. It builds the cohesiveness bond of what it means to be a member of our society and show the caring attitude that we should have for every individual to give them the second chance. But this is not enough, right? We have to follow up with treatment. We have to give people the opportunity to get the treatment they need to pull themselves out of the cycle of addiction that sometimes can lead to the cycle of incarceration that can rip families apart and destroy our community. want to end with a story that is touching to me about how important Narcan is. That right now we do 5 to 7 Narcan runs a day in the city of Columbus with our EMS personnel. Our police also carry Narcan because of how big this problem is in our community. So we're stepping up to the plate by allowing police to also carry Narcan. Equitas Health is stepping up to the plate to make this readily accessible, recognizing the problem that we have. But one of our EMS personnel showed up on a scene and a 34-day-old baby was overdosing because the mom was breastfeeding and the opiate got into the baby system. The Narcan that was administered on the scene saved that baby's life, 34 days old. This is a problem that affects everyone. Leadership in the City of Columbus, in partnership with Equitas Health and the Department of Public Health, are here to make a difference. And we appreciate what you're doing and what Equitas is doing. And this is just the beginning. We need to follow up with treatment to continue to work with our not-for-profits to make sure that there is access to funding that is available for treatment. The funding that City Council is doing is $10,000 in partnership with the Department of Public Health and Equitas to make this a reality. We're going to keep going until we solve this problem and do our best to tackle addiction in the City of Columbus, to give people the second chance they need, to make our community safer and to make our community healthier. So thank you.
Thank you.
Mm-hmm.